I always get several questions about VBAC deliveries. What is a VBAC delivery, and is it advisable or is it safe? Patients who have had 1 or 2 previous Caesarean sections qualify for what we call a VBAC, or a vaginal birth after Caesarean section. Those patients should have an incision that's transverse, which means it runs, horizontally across the uterus. And the way we decide is we get the patient's previous operative report. Because on the skin, we can make incisions that run up and down, or they can be horizontal and still make a different incision on the uterus. The reason that that's important is patients with a transverse incision, we call it a lower segment transverse incision, those patients are candidates for a VBAC. The rupture rate, and this is where safety comes into play, the rupture rate, which would be the most concerning outcome of a VBAC that's gone wrong, is approximately, well, actually it's less than 1%. So if a patient comes in labor on their own with a prior 1 or 2 Caesarean sections that have been transverse in nature, those patients have a less than a 1% risk of rupture. Patients that have a vertical incision, so one that is running up and down the length of the uterus, those patients are not candidates. Their rupture rate is higher and unacceptable as far as from a risk standpoint. So those patients we don't encourage. In the long run, VBACs are always nice because patients bounce back much more quickly following a vaginal delivery versus a major abdominal procedure. It's much less expensive, much less painful, and once again, patients are back on their feet quickly after a VBAC. So we really encourage it if you're an appropriate candidate for a trial of labor and a VBAC. Again, we encourage it. For the most part, it's generally a positive experience.